Hi, my name is Amy Stevens.
I'm Philip Stevens.
I'm Will.
I'm Wesley.
Selma.
Let me see.
Yes.
Hope. It is the dead of night, and you are in the emergency room with your child. You're told your child is very ill, and the only place to treat your child's condition is very far away from home. The first thought is fear for your child. The next thought is telling everyone because you're so scared. And then the fear is, how am I going to deal with this? And after all that, the fear of how I'm going to afford this sets in. As a mother of a chronically ill child, I can tell you there are many scary factors that come with having a sick kid. It's emotionally, physically, and financially draining. I want to speak to you today about why you should donate to a charitable organization that helps parents and children through emotionally and financially hard times whenever you're dealing with a chronically ill child. The last thing a person should worry about when their child is sick is how they can afford to take care of everything. The last thing on your mind is usually your own well-being. Your energy as a parent should be focused on the healing of your child. I hope none of you are ever in this situation, but I also hope that if you are, there will be somebody there to help you. The definition of charity, according to Webster's Dictionary, is an act of kindness, of giving money, food, or time to those who are poor or sick. In my opinion, it is so much more than that. It's the act of helping ease someone in a time of need. Many organizations help to fill this role. The Ronald McDonald House. The Ronald McDonald House offers housing to parents of chronically ill or very injured children at low or no cost. They offer hot meals at least once a day. Usually they offer recreational facilities along with exercise facilities, counselors. They have a whole lot of stuff to help you. Usually they're located right next to the hospital so that you're able to stay there and still be with your child whenever they're sick and go to the hospital. According to the Ronald McDonald House mission statement, our houses are built on the simple idea that nothing else should matter when family is focused on the health of their child. Not where they can afford to stay, where they will get their next meal, or where they will lay their head at night to rest. Another wonderful organization is Children Angel Flight. Children Angel Flight facilitates no-cost or reduced-rate commercial airline flights for needy child patients and their families, children. According to Children Angel Flight's mission statement, to ensure that no needy child patient is denied access to distant specialized medical evaluation, diagnosis, or treatment for lack of a means of long-distance commercial airplane transportation. Basically what this means is they make sure that children can get where they need to be seen about, even if it's just a consultation, you can contact them. Some things, like my son has hereditary pancreatitis, and there's not a pancreatic specialist in the state of Georgia. And so, therefore, if we were to go see a pancreatic specialist, we would have to go somewhere, probably fly to Minnesota. So. Now that we have talked about housing and transportation, I'd like to talk about another source which helps families come together and understand the impact of a sick child on the family. Child Life. According to the Child Life mission statement, a Child Life team is made up of trained professionals who work with patients and families to help reduce the stress and anxiety that can be associated with a healthcare experience. The Child Life team works to meet the developmental, psychological, educational, and emotional needs of patients and families through a variety of services. They help children cope with being sick in the hospital. They help families cope, and that includes siblings. They offer therapy through play, and they also explain to the children what's going on as part of their services that they offer whenever the kids are having some kind of procedure done. Now that we've talked about a couple of charities that help families in need, let's talk about why this help is so important to these families. Family-centered care is very important to a child's well-being. According to Tracy Davenport, a clinical psychologist and leading expert on family-centered care, the reason to fully participate has to do with the daily observations of your baby or child. No physician, no matter how well educated, will know your baby like you do. If you're a responsible part of the healthcare team, you will probably be the one to record the day-to-day observation of things, like how the baby slept, how they ate, and which treatments seem to help the most. Basically, this means that you've got to be their advocate. You have to be there, you have to go to the doctor's appointments, and you're what they have in common. And that goes with consistency of care. You make sure that all of the doctors are on the same page, they're getting the medicines they need. You can't get, 2 medicines with Tylenol to give back to back, those kind of things. That's your job as a parent. And without that, the child could fall through the cracks with things like that. Though a child with severe illness may have several doctors, parents are the one factor that they have in common. And as a full member of your child's healthcare team, you ensure that decisions are made with your child's best interest at heart. Risk factors in children without family-oriented care, they have a harder time coping. They oftentimes get very upset, very agitated. Children can become depressed without a good support group, especially if they're going through something chronic, very painful, cancer, treatments, those kind of things. They don't have some type of family with them all the time. And most of all, they do not have a good advocate for them. So they may get whatever the doctors are just trying to push on them, and they don't have anybody to stand up. In order for these organizations to continue to function, they need donations and volunteers. Volunteering your time. You can do arts and crafts at local hospitals, babysitting time at your local Ronald McDonald House. There's lots of things you can do. Volunteer for a fundraiser for your charity. Donations, even a little bit helps. Any little bit of money that you can come up with. You can do a fundraiser yourself and donate money to these things. Also, toys, art supplies, video games, and coloring books are all great things to donate. Now that you know about volunteering and donating your time, let's talk about the benefits for you. The benefits are amazing. Volunteering increases self-confidence, it combats depression, and it can teach you new skills. According to a study done at Harvard Medical School, when researchers at the London School of Economics examined the relationship between volunteering and measures of happiness in a large group of American adults, they found the more people volunteered, the happier they were. Most donations are tax deductible, and it gives you a sense of helping others. In conclusion, when you volunteer and give donations, everybody reaps the benefit. I try to persuade you to donate or volunteer to a worthy cause. You may be enabling a family with a sick child to have family-centered care. This is better for the child, and there are many benefits to you as well. Act now. How often do you have a chance to really impact someone's life? Something small to you may be big to them. Thank you.